Hi YouTube, this is Kara, Fat Girl to Slim Girl. Welcome to my channel, and this is my day one post-op. So I guess I'm just going to talk about my surgery experience, and a couple of other things. Sorry, my voice is still a bit sore. Well, anyway, so I went to the hospital at I got there at 6 o'clock. I was supposed to be there by 5:30, but my mom and her boyfriend kind of made me late. And believe it or not, the person who was going for surgery, actually had to make their breakfast so that we weren't late. I mean, whatever. Anyway, I went to the hospital at 6. I went to the admitting area. They called me back into it was like the nurses station, and they had like a couple of rooms there I could sit. Excuse me. I'm sorry. I've been having gas because they inflate your abdomen with a lot of gas. So CO2 with gas, I believe. And so I've been burping all day, and I guess it's better than coming out the other end, right? Excuse me. Well, anyway, I went there, I changed into my scrubs, and then, actually, my mom was with me that time, and then they called me back, to another room. I had to get on, it was like this place where they would set you up for, the operation. They put me on a gurney, and they asked me a couple of questions about things I'm allergic to. They asked me, they wanted to look at my tongue, in my mouth or whatever, for some reason, I don't know. Asked me if I had any dentures or anything. If I don't. And then the anesthesiologist came and gave me an intravenous tube with some fluids, and then she started setting up for whatever she was going to do. And then some nurses came, and they introduced themselves to me. Said, okay, we're going to be your nurses. I had one more experienced nurse, and then one nurse that was relatively new, which is alright. You have to know something in order to graduate from nursing school, so it wasn't a huge deal to me. And then my surgeon came, my surgeon and his physician's assistant that I met at the office. When I first started going to his office, she was actually on maternity leave, so this was my second time seeing her. Yeah, so. And then, she chatted with me for a little bit, and my surgeon came, and he, chatted with me for a little, said, okay, we're going to go in soon, and, you're going to get your surgery. I asked what size band I was getting, but the physician's assistant told me it really depends on my anatomy when the doctor looks inside to see what's going on and how big everything is, and then he would decide which band to give me. So after that, I was wheeled into the OR, and then they asked me to go from the gurney to the operating table, so I had to, shift over. And then I had to lay back. They had me lying on this weird position, because they have, these pillows, like right under your chest, and then like they have like a head hold part where they hold your head. That's the pillows under the chest. Or they said were to expand that area, like your lungs and everything. So after that, I don't really remember what happened because they knocked me out, and then I came to, and I was in pain. I was like, it hurts, and you know, like I guess it was a lot of gas pain and, you know, a lot of incision pain too. So they gave me some drugs. Not really sure what they gave me, but they gave me something. And I was in and out, like sleeping, waking up. Then I finally got up, and you know, I had a male nurse attending to me. He was really nice, and like, okay, we'll get you some water after, you know, we send you to get an x-ray to see how everything is situated, see there's no blockages and all that. Like, they wouldn't even give me any water to wet my lips at that point, which I was kind of annoyed about. But, you know, I understand. Anyway, after taking my blood pressure a few times, making sure I had oxygen and all that, they wheeled me over to get my x-ray. I just saw this kind of bitter tasting fluid. It was really gross. And, you know, afterwards, after they got the results back, like, an hour or two or later, then they, it felt like an hour or two at least, I don't know. Then, they gave me some water, or some apple juice actually, diluted apple juice. And, you know, I was in recovery for a while, and then, you know, my mom came back, and she came to take me home, so then I went home with my mom, and all that. So, picked up some, like, some Jell-Os, because I actually also got a visit from the dietitian while I was in the hospital, and she said, yeah, you should just eat, like, Jell-Os and ice pops or whatever for the first day, and then you could start on your shakes the second day. And I went in with my mom, and she picked those up for me, and then I went to the pharmacy and got my prescription for it's oxycodone to relieve the pain, and you know, to take as needed. And they also prescribed me some medicine for nausea, but I haven't really needed it. I haven't been feeling nauseous or anything, so it's been all good in that area. So I'm gonna show you guys another video about the stuff that I'm, you know, using right now. So I'm gonna stop this one and then make a part 2. Okay. Thanks. Bye.